Thank you, Mr. Chair, and thank you, Ranking Member Bergman, and thank you to all of our witnesses who provide testimony today. So as a physician and a 24-year military veteran, I've had the opportunity to be, first having gone to medical school at the University of Texas and did work at the VA hospital that was there in their collaboration process, and then did my residency at the University of Iowa, which used both VA facilities, both in Iowa City and Des Moines, and then was on faculty in the Department of Ophthalmology at the University of Iowa, also again working in this collaborative process where medical schools are associated and integrated with the VA medical facilities there. So this certainly is a very important and timely process. And Mr. Murray, I want to also thank you for your comments about the VA's role in hiring, the hiring process and the retention of medical providers. I can tell you that after I left as the director of the Department of Public Health, applied for a job at the VA, and it took so long to even hear back. And as a veteran, and I'm supposed to have veterans preference, it took so long to hear back that by that time I had had numerous other job offers. So as a physician or healthcare provider in demand, that hiring and retention process absolutely needs to be updated, and it needs to be much more speedy. So with that, Mr. Murray, there are concerns about the data that the VA used to make recommendations to the Air Commission, since some of that data was collected during the pandemic. And do you share those concerns, and would the VFW support extending the timeline to allow VA additional time to verify the reliability of the market assessment data?
Ma'am, thank you for that question. And I guess let me answer that in two parts. Concerned about the data? I don't know. We're still going through it right now. We want to verify. I can't say right now that it's completely accurate, but we do want to make sure it is. The part about extending, we believe that the Air Commission needs the full amount of time that it was originally set up for. If this is done in any kind of half-baked manner, no one's going to accept it. It has to be given the full time to do the reviews, the recommendations, and provide transparent and accurate assessments in order for this to be accepted. It seems to be the only one thing that we hear about conclusively in Washington, D.C., that everybody doesn't like the Air Commission. But we do want to make sure that it is accurate information so we can stand by that, put our hands on it, and say, this is valid.
Yeah. To that end, Dr. Brennan, what would you say to those who fear that the data the VA used to make recommendations to the Air Commission is faulty because it was collected during the pandemic? And does the VA have any current plans to update or refine the market assessments to verify them?
Thank you for that question, Congressman. There was a lot of data to collect during that analysis, and all of that data is available on the VA report's website. And the sheer undertaking and volume that it undertook to do those market assessments spanned a long period of time, and throw COVID and other things in there. The Secretary has discussed the need to update the data used during the market assessment, and our focus during the collaborative period with the Air Commission review process is to inject some new data that we have, and along the lines of COVID-19, in addition with the collaborative questions and feedback we get on the data calls we move through the process.
Thank you very much for that. And then what would you say are the biggest lessons the VA has learned thus far with the chip-in pilot, and how are those lessons informing the VA's future plans with respect to facility-focused partnership efforts?
Yes, ma'am. I'm really excited to talk about the Omaha chip-in project, and I'll hand off in a moment to Mr. McDivitt as that was in his review and his vision. We had a highly successful partnership there. They delivered that project on time, on cost, and it is reaping bucket full of awards since the day it's opened up. We garnered those lessons learned from that partnership and use them in real time. And I'll touch on just a moment a little bit on Tulsa, but we were able to take those lessons learned, and also our private team partners there, those lessons learned to transfer to Tulsa as well in the next project. one challenge we have is that the difference between the project types. We have lessons learned that we learned in Tulsa, which is a grand slam home run, but now we have a different project type in Tulsa. We're learning different lessons. What we do know for sure is we've demonstrated what the private sector and their construction methodologies can do to deliver on cost and on time. We absolutely need to replicate those in future partnerships, but also in our own major construction.
Thank you very much. I yield back my time.